In this video, we're going to talk about the hips, and we're going to do a hip flexor exercise to kind of get everything moving and get that hip rotation going again. So you're going to lay on your back. You don't need any props for this. Lay on your back. You're gonna bring one leg up. You can hold underneath the knee or right here if that feels good. You're gonna bring it in as close as you can, and we're just gonna make tiny, tiny little circles. You start coming in. So to exaggerate it, we're doing this. We're making a circular motion, but it's gonna be itty, itty bitty. So just tiny. I think my hip flexors are always tight, so to me it feels like rope on rope. Leave a comment if you feel something differently, because I don't think I know what it's like to not have tight hip flexors. I'm getting there though, it's a lot better. My gait, the way I walk at least, isn't compensating for it. So tiny little circles, pausing anywhere that maybe feels shaky or super tight or really good. Deep breaths, breathe into it. And then you're gonna relax it a little bit and go back the other way. So we're gonna circle, make this circle the other direction. And just notice if you feel like, are you able to make a circle, or is it an odd shape? Maybe that hip mobility's limited and there's some compensation of how the circle is. And then we're going to go and do the other leg. Tiny little circles, starting counterclockwise. Oh, well, that was tight. We don't want to feel any pain, so be very careful if you hit a spot like I just did. I'm just going to come right up to it and stay right before I jump over that area. Deep breath in. So what this tells me is that it's very difficult on this inner part, and I know that this adductor is incredibly tight, so I'm not surprised that it's trying to jump over that spot. So I will do an adductor stretch for myself after this. All right, and shake it out, and we'll reverse it and go the other way. Part of it's just knowing and finding out what else is tight that maybe you didn't know about, because I don't feel that adductor being tight, but it sure as heck is. And then anytime I do an adductor stretch, I feel how tight it is, but it doesn't bother me throughout the day. So it's finding those little hidden things that don't necessarily bother you, but are causing you to compensate. Okay, and then we're gonna do a little sacral massage before we come out of it. Lean over to the side, roll up. And that is a simple little hip flexor that you can start to do. If the hip mobility and hip cars are too difficult for you, that's a great place to start. Or if you like to do the hip cars and hip mobility, that's a good fascial stretch to warm up into it.